Hello, good afternoon, and welcome to today's edition of the afternoon edition. My name is Isa Nu. Today we shall be focusing on the rising cost of pharmaceutical products, and most especially drugs that we get from the hospital, and that has been a major challenge to many Nigerians who visit the hospital to get an improved health status. It also goes beyond the issue of even getting drugs. The cost of medication in general is a major issue to many Nigerians, and the complaint seems to be increasing on a daily basis. So let me just take you through this snippet, and when we are done, you get a better understanding of what our conversation is going to focus on today, as our guest will be joining us live from Kano State. He was a former Pharmaceutical Council chairman of Kano State. But then, let me take you through the snippet, and then we go deeply into the conversation after the break. Let me just go through. Have you or a loved one struggled to afford necessary medications? You are not alone. We are all part of this. The rising cost of drugs are a growing concern for many Nigerians, and it is not just a personal issue, but an economic one too. The cost of drugs in Nigeria has skyrocketed in recent years, making it difficult for people to access the medication they need. This does not only affect their health, but also has a ripple effect on our community, and most especially the economy as a whole. When people can't afford medication, they may delay or forego treatment, leading to reduced productivity, increased hospitalizations, and even premature death. But that's not all. The high cost of drugs also put a strain on our healthcare system, diverting resources away from the essential sectors like our struggling primary healthcare centers and hospitals. So what can be done to address this issue in Nigeria? Many have suggested a policy change through strengthening of our institutions are responsible for the healthcare sector, and then others have also pushed for the need for the local content production of some of our pharmaceuticals, and also looking at the major challenge of investment and foreign direct investment into this particular local content development. But it's not just about the policy change. We also need a change in our mindset. We need to recognize that access to affordable healthcare is a fundamental right, not a privilege. We need to prioritize prevention over treatment and invest in public health programs that keep us healthy and productive. Imagine being diagnosed with a chronic illness like diabetes or hypertension, only to find out that the medication you need to manage your condition costs more than your monthly income. This is the harsh reality for many poor patients in Nigeria hospitals today. They are forced to make impossible choices between buying food, paying rent, or purchasing medication. And often they are left with no choice but to go without treatment, putting their health and lives at risk. The situation is even more dire for those living with rare or complex conditions that require expensive specialized treatment. For instance, cancer. The cost of drugs can quickly drain their managerial resources, pushing them deeper into poverty. And when they are unable to access the medication they need, their condition suffers, leading to increased hospitalizations, complications, and even premature death. It's not just the patient who suffer, their families and communities bear the brunt of the burden too. When a breadwinner falls ill and can't access treatment, the entire family's well-being is threatened. And when poor patients are forced to seek care for substandard providers or resort to counterfeit drugs, the consequences can be deadly. The rising cost of drugs are a ticking time bomb for our economy. Let's work together to find solutions that prioritize our health and well-being without breaking the bank. So thank you for tuning in on this particular program today, because we'll be having a former chairman of the Pharmaceutical Society of Nigeria, Kano State, Mr. Ahmed Ibrahim, or pharmacist Ahmed Ibrahim Umar, who is the Deputy Director, Drugs Manufacturing Unit, Aminu Kano Teaching Hospital. to be joining us on this program via Skype just after the break. Welcome back from that break. And now let us just go straightly to the conversation. Good afternoon, Mr. Ahmed Ibrahim Umar. It's nice having you today on the afternoon edition. Okay. Sir, can you hear me now?
Yes, I can hear you.
Okay, while we are still trying to get a very strong connectivity, just like I've rightly stated, okay, he's here now. Can you hear me? Good afternoon, sir.
I can hear you. Good afternoon. I'm glad to
be here. It's nice having you today on the afternoon edition, and this is a critical aspect of the economy. Whosoever leads Nigeria definitely will know that health is one major issue in the country. We have health, we have agriculture, we have education. But as at this particular point in time now, we are focusing on health, of which you are a major stakeholder in this particular field. When we talk about drugs in Nigeria, most especially in our pharmacy, in our medical facilities, is becoming a major issue in the sense that we are having rising costs of drugs today in most of our hospitals. So what could be the major reason behind all this?
Yeah, good afternoon once again, and thank you for the invitation. I think what you have said is true. Over the past few years, we have seen medicines prices rise astronomically in a manner that we cannot say we will be able to control it as a people. And that has an impact both on the individual, on families, and on the national healthcare delivery system. The reasons are not far-fetched. The first one is our heavy reliance on imported medicines. More than 70% of our medicines used in our healthcare delivery systems are imported. And once we are import dependent in that manner, it means that the fate of prices of your medicines will naturally rely on two things. It will rely on the proportion at which you import. It will rely on the prevailing exchange rate. And you will agree with me that over the past few months, the dollar is on alcohol, right? So it has been rising and rising and rising. So that has reflected negatively on the price of medicines. Secondly, we have regulatory challenges. Everybody that produces medicines is naturally in business, and businesses are there to make profit. So once the price of quality is that those regulatory agencies like the National Agency for Food, Drugs Administration and Control will, as a matter of necessity, have to impose certain requirements for ensuring good manufacturing practices and ensuring the quality of medicines that we consume. Unfortunately, that enforcement, that recommendation of good quality will have to come at a price. And then the price will naturally have to be borne by the consumer. And then we have other things like the inefficient supply chain system and our infrastructure that requires medicines to be transported from very far distances, and then the road networks and things like that, the poor logistics and the participation of people whose interest is simply profitability and not the health of the healthcare delivery system itself. And then we have things like taxations and lastly, the intellectual property rights system that ensures that certain medicines enjoys monopoly over a certain period of time. And you know that monopoly breeds higher prices.
You've stated so much, and one key aspect that you've raised is on the issue of the Forex. And we understand that, yes, Forex has a major impact, not just in the health sector, but other sectors. But also, we've also noticed that recently we've seen a dwindling of the dollar-naira ratio, and we've seen that the naira has been gaining strength. So does that mean that we are also going to have that impact on the drugs that we purchase in our pharmacy or probably in any of the medical facilities we find ourselves?
Yeah, not in the immediate. probably in the long term, if the Naira consistently gains strength the way we have been seeing, the traction has consistently maintained itself, then we are most likely going to see an improvement in the prices of medicines and accessibility of medicines by the poor. But for now, we have to make do with the fact that, like the pharmaceutical importers will tell you, they have already all stocks that they have bought at very high exchange rates, and those high stocks will have to be extended over a period of time before we begin to see the effect of the strengthening of the Naira in maybe due course.
Okay, but in this particular aspect now that we are having this particular situation, I also understand that you are one of the key stakeholders when it comes to the issue of pharmacy or pharmaceutical products in Nigeria, most especially being part of those who manages the drug production unit in Aminu Kano Teaching Hospital, and Kano also seem to be a base where other neighboring states get most of their drugs from, due to the fact that, yes, production, there are so many production in Kano. So what is stopping those in this local industry from producing enough drugs to cater for the well-being of the nation?
If I understand your question, you are asking why we are unable to produce enough drugs for the requirements of our own population. That largely has to do with so many things. Kano, for example, has a population of 15 million or thereabout, and then you see there are neighboring states that rely heavily on Kano, and even countries like the Republic and Chad that rely on Kano for the pharmaceutical medicine needs. Thus, Nigeria as a country has not been able to be self-sufficient in manufacturing its own what we call active pharmaceutical ingredients, which are the ones that we use as primary ingredients in the manufacture of medicines. So that has to do with level of development, and then level of commitment, and then the petrochemical industry's level of development, as well as a primary supplier of chemicals for the production of active pharmaceutical ingredients. So these are some of the factors. It's all tied to our own level of development. We have to be intentional about it. We have to be deliberate in the investment in the pharmaceutical sector and the petrochemical industry as a primary source of raw material for the pharmaceutical industry. And then we have to be intentional in terms of our investment in monies in the pharmaceutical industry for self-sufficiency. Drugs are matters of security. They are no longer matters of ill health. We saw what happened during COVID, where borders were shut down, and then everybody will have to put his hands on his slabs. So we were very exposed at that time because our local manufacturing capacity was very, very poor.
Now, currently, if you look at the economy, we're having an open market where the buyer and the seller decides on what they are going to sell, at what cost are they going to sell it, and then the buyer is also having that understanding with the seller. Has that really affected the rising cost of drugs in the market? And what can pharmacists like you do, being the fact that you were once there as the state chairperson of the Pharmaceutical Society of Nigeria? And also, how can you relate with the distributors in such a way that they won't have to cut the necks of Nigeria for them to buy drugs as low as Panadol for them to be able to take care of their health?
Well, let me start from your second question. You know, in pharmaceutical practice, once we say open drug markets, we are very bothered because we are referring to actors in the system that are not regulated and not regulated. We are referring to actors.
I'm listening, please.
Okay. One is the term of open drug market in the pharmaceutical practice generally. We mean people that are in the drug distribution chain that are not registered with the relevant regulatory agencies. I mean places specifically like Area Market in Aba. I mean places like Idumota Market in Lagos. I mean places like the Bridgehead Market in Onisha. I mean places like Sabangari Market in Kano. The issue why those ones are of concern and how it relates to the prices of medicines is that, you have a difference when somebody's interest is. Their interest largely is in the profitability of their participation in the drug distribution chain, not merely the availability of medicines for the healthcare delivery system. So when we have such types of people participating in such type of way, an indiscriminate way, when we have a democracy and a country where we have a law and an extant law that prohibits the sale of drugs in open market, any means of transportation in roadside stores and things like that, then you have a problem.
You're reading in the sense that we have the Pharmaceutical Society of Nigeria, we have the Pharmaceutical Council of Nigeria, we have NAFDAC, we have, is it NIPRID, or I've forgotten the name now. We have so many institutions that are supposed to check all these. Are they really doing their duty?
They are. They are doing what they can. They are doing what they can. But every regulatory agency, whatever it is, has to operate within the context of the ability of the Nigerian state. You see, the Pharmacy Council of Nigeria has rather bravely
Okay, we seem to be having a network breach, and definitely you will definitely join us to continue with this conversation, because this particular aspect is very, very key to our discussion, where we have so many institutions who are actually supposed to regulate this particular industry, but we still see a lot of openings with respect to having fake drugs in the society, all in the name of you trying to get cheaper drug. You end up paying more even for the cheaper drug than even getting the actual drugs, the right drugs for your health. And these are some of the things that are actually pulling the weight when it comes to the issue of getting drugs for your health. And at the same time, again, he mentioned something very, very important. When you look at the exchange rate, it has actually had major impact in this particular sector, the pharmaceutical sector in Nigeria here. Because when you look at the cost of getting some of these drugs into the country, and even the cost of producing some of these drugs, it has actually helped in skyrocketing the price. But the issue is there no way, or is this how we are going to survive? Just like I've read during my intro, that if it continues like this, we see people having premature death, death that is avoidable, or probably sickness that is avoidable. You see people still having it for a longer period and weakening their immune system. And at the end of the day, when your immune system is weak, definitely what comes next? So this is one critical aspect in the sector that Nigerians need to actually pay more attention to. If the issue of health is not properly dealt with, how can we survive to make the best out of the nation? So we'll go back to him, and Mr. Ibrahim, if you are back, please, can you just respond quickly to our last question? Okay, pending that, we'll be going on a very short break, and definitely when we return, we continue with Mr. Ibrahim Umar to tell us more on this particular aspect. Okay, welcome back from that long break. That was as a result of making sure that, yes, we get our guest back on track. Discussing this particular issue is very, very key, and for him to have stated so much and giving us an opening understanding on the situation of things, definitely I'll have to quickly still remind him of our last question. If this particular agency is responsible for making sure that things work effectively, are not actually carrying out all the needed support they need to give to probably maybe our local industry, or probably the needed vettings they need to profile to some of this industry, then what is now the fate of Nigerians who are seeking for medical attention with this high cost of drugs?
I think in the current circumstances, the first thing Nigerians will have to do will have to prevail on government through their elected representatives to ensure that, as it happened in Kano, all illegal operators that are participating in the distribution and sale of medicines through illegal drug markets, like I earlier mentioned, like the one in Idumota in Lagos, the one in Aria in Aba, and the one in Sabangari Market in Kano. All these ones, they should ensure that they are closed down through their representatives, because that is in pursuance of an extant law in Nigeria. There is what we call the Counterfeit and Fake Drugs and Unwholesome Processed Food Miscellaneous Provisions Act that has prevented the sale of drugs in the market, and that is intentional only because the participation of people that are not licensed, that are not qualified, lead to a skyrocketing price of drugs in the healthcare delivery system.
Making sure that yes, we have the best of leadership, irrespective, be it political or non-political leadership. Even as a pharmacist, when you have good leaders, definitely you see more of quality in terms of how you dispense your drugs, how you manufacture the drugs, and also you also see so much in terms of the benefits that the society is going to derive. But one key aspect that we've not actually mentioned in all this is that we also understand that yes, taxation has played a key role in terms of how you cost drugs in this particular sector. What can you say with respect to taxation on the cost of drugs?
Well, at this point, every well-meaning individual, not just a pharmacist, at the local government level, to understand that drugs are not ordinary articles of commerce. They are things that are needed when you may be unconscious. So the question of humane taxation of medicines, and when drugs are imported, they should, as much as is possible, be duty-free, especially those raw materials that are necessary for the local production of medicines that we see. That is the meager 30% that we manufacture. So those raw materials for the manufacture of those meager 30% should be duty-free, in the understanding that if they are not duty-free, whatever cost a manufacturer incurs, he shall transfer it to the patient or the healthcare delivery system as a whole. And once there is a strain in the healthcare delivery system, it is not just a matter of an individual, it is not just a matter of the family system, it is a matter of a strain on the national healthcare delivery system. So we'll have a situation where, rather than the national healthcare delivery system concentrating on the procurement of new equipments, concentrating on the training of manpower, concentrating on ensuring that there are more facilities, we now have to redirect our attention to the procurement of medicines, which is the most important thing in the credibility of the healthcare system.
But have the pharmacists as a family in Nigeria come together and actually sit down to look more on how they can make sure that yes, Nigerians have easy access to these drugs in terms of they can be able to pay for the drugs? Have they really come out to sit down and find solution to this particular problem?
Yeah, I can see what you are saying. It should be such that the person in the remotest part of Nigeria, like my village in Zalawi in Bauchi State, should be able to have equal access to medicines as somebody that is staying in the midstream of Kano or Lagos or anywhere. And the only way that can be achieved is having a managed healthcare system where there is a comprehensive insurance system for health and medicines. And that can only be possible when people pay their premiums, and then in the implementation of the national healthcare delivery system, all stakeholders like doctors, pharmacists, nurses, and all those stakeholders in health should be taken into account. The reason why health insurance is important, not just that it brings down the prices of medicines and improve accessibility, it is because of the simple logical fact that at the time you require help, you may not be conscious. So if somebody coming from my village down to Kano, for example, had an accident, and then he will have to pay from his pocket for him to get treatment. That is very, very, very unfortunate. That will have to be a situation that will have to be looked into. The expansion of the national national health insurance scheme to ensure universal coverage.
Okay, moving forward now, for instance, in Kano State, where you've actually stated, and I also understand that, yes, the population is much, unlike other states, where the population may not all be much as that of Kano, but they don't have active drug production unit, like Aminu Kano University Teaching Hospital. How will those people, in terms of price variation, how will they cope? Those who are far from, just like you stated, Jigawa State, for instance.
Even when Jigawa State has an active drug pharmaceutical production unit, there is still going to be a problem. As long as we are going to be importing the very things we require to make drugs. Indians do, like the Chinese do. So the attention of the Nigerian state should be in two respects. Number one, we cannot have a country where you have an entire geopolitical East, for example, not having a single pharmaceutical manufacturing plant. That is very disastrous. You are saying that 15 million people are condemned to importation of 100% of what they use as medicines. So the second thing is that even when there is an existing manufacturing facility there, like the one in Aminu Kano Teaching Hospital, there has to be concerted effort by the government to ensure that what they use as raw material is available, is accessible, and of reasonable price, so that by the time they manufacture it, it comes to the consumer at a very, very reasonable price.
What solution do you think the government will have to put in place in order to see that, yes, we quickly overcome this particular challenge of increment in terms of drugs?
Well, like I said earlier, the first thing is to sanitize the sector. The operators operate in the system. Well, of course, legal operators are not saints. They are also profit-driven. But the problem between legal operators and those ones that are not legal operators is that legal operators are regulated. They have a regulatory body that can enforce sanctions on them. Years back, I have heard of the case of a pharmacist that was enforced 13-year ban on practice. So if you have that kind of thing where you enforce the extant laws and only legal operators are participating in the drug distribution chain, you would have achieved something.
Hello, are you with us?
Yeah, I am. Can you hear
okay.
me?
Okay, if you can just continue on that thought line so that we can get you clear, because the network had a glitch just now.
But what I'm saying is that if there are things the Nigerian state can do, it should be three things. The first thing is to ensure sanitization of the system itself in such a way that only legal operators, that is registered pharmacists, those qualified to deal in medicines, only participate in the system. Like I was telling you, we cannot say that legal operators are saints. No, they are not saints. They are also profit-driven. But the difference between a legal operator and a non-legal operator is the fact that the legal operator has a regulatory body that can impose sanctions on whatever he does. So there is a limit to what he can do. The second thing is to ensure that the Nigerian state becomes intentional and deliberate in terms of ensuring that whatever is brought into this country that is intended for the manufacture of medicines, be it equipment, be it the primary active ingredient, is duty-free, and they should facilitate that. The third thing is that they should ensure financing of the pharmaceutical industry, the pharmaceutical sector, or the manufacturing sector. They should be intentional about that. The Central Bank of Nigeria is doing something, but then, you know, that is a very little effort they are doing compared to what the demand is in the nation.
Okay, you said the central bank are doing something, and I remember recently I had a conversation with somebody from the civil society organization with respect to this same issue. Are you in line with the central bank, or probably those who are pushing for the issue of the National Health Bank? Are you in line with them that they should establish a National Health Bank where things like this can easily be solved, and where succor is needed, the National Health Bank can quickly come in to probably subsidize some of these drugs?
I think what I would say in that respect is that I'm in line with any arrangement of government policy, of government laws that will facilitate access of funds to pharmaceutical manufacturers, local pharmaceutical manufacturers, whether it is the National Health Bank or the Central Bank or any dedicated funding from the federal government. I think one should be happy about that.
Okay, now going beyond this particular situation now, and we are now at a point whereby if you look at things critically, people have also complained that we don't have enough pharmacists in the country to cater for the health status of Nigerians. Is that correct?
That is very correct. Not only that we do not have enough pharmacists, we are facing three things now. Number one, we do not have enough pharmacists in terms of numbers. I think the number is now hovering between, I think, 20,000, 20-something thousand in the whole country of 200 million. So you can see that is very, 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 very small in terms of the requirement. The second thing is that the number of pharmacy schools. The number of pharmacy schools not only needed to be increased, they only needed to be evenly distributed in parts of the country so that we will have a situation where we have enough pharmacists. The third thing is that the government should create a certain kind of environment in the civil service and out of the civil service so that we reduce the brain drain that is happening in the pharmacy profession. A large number of pharmacists, including my classmates, we graduated at 100 and something. By then, I don't think we have 50 practicing in this country. So what is happening now is that we are training, the government is using its own resources to train manpower for other countries. And I don't think that's acceptable. At a point, last few months, the WHO enlisted Nigeria as part of the countries where developed countries cannot actually recruit pharmacists and doctors from.
This is a very huge issue of concern for the WHO to have listed Nigerians. Definitely is not a very good one. But then on a climax now, can you just give us a roundup statement with respect to how you feel Nigerians should react to these situations?
Well, Nigerians are at the receiving end. I think maybe a rephrasing of the question should be, how will the government react to this situation? The opening lines of our constitution says the welfare of the citizenry is the primary responsibility of government, is the primary responsibility of government. So in pursuance of that, the government should add upon what it is doing. We understand that, of course, they run the federal teaching hospitals, they are doing a lot, they are not sleeping. In fact, this current administration, for example, has appointed an office specifically dedicated to unlocking the healthcare value chain. But, you know, in a country of 200 million, you know, such efforts must naturally be seen not to be enough if the indices are still showing that they are not enough. We still have problems with access to medicines. We still have high infant mortality. We still have a lot of under 5 and a lot of things like that. So these are issues for which the government has to sit down, call in all the stakeholders, the Pharmaceutical Society of Nigeria, the Nigerian Medical Association, the National Association of Nigerian Nurses and Midwives, all stakeholders, including cleaners in the system, to sit down and fashion out and come out with a strategy, a workable one, a workable, implementable one that will sort the problem of drug prices in Nigeria and accessibility.
Okay, thank you so much, Pharmacist Ahmed Ibrahim Umar, for joining us today on the afternoon edition. And I can guarantee you that so many government officials are listening to this particular program and will definitely, most of them of which definitely are in the policy sector, and I know definitely they must have picked one or two things that you've rightly stated and then definitely take action based on this. This is how far we can go today, and we so much appreciate your effort for being online with us. So this is how far we can go today on the afternoon edition. Joining us from Kano was Pharmacist Ahmed Ibrahim Umar, who is a former chairman of the Pharmaceutical Society of Nigeria Kano State Branch, and also the Deputy Director, Drugs Manufacturing Unit of the Aminu Kano Teaching Hospital in Kano State. our focus definitely was to see that we can unbundle this particular issue to the betterment of the nation. My name is Issa Nuhu. Have a wonderful day and stay blessed.